Hey, it's Dr. Lowenstein here. Two in a row, day 2 in a row of Facebook Live, so maybe this is a trend. But I want to talk to you real quick about intraoperative judgment. I just finished a case, breast augmentation, and we planned on a lift. So the way we do things, a lot of patients are kind of on the border. We don't really know if you need a lift, but we suspect you need a lift. So what we do is we talk about all of the options everywhere. We talk about what kind of implants we're going to use, what the incision is, what the pocket is going to be like, the different kinds of lifts, etc. And we plan on doing a lift. But then in the operation, I use judgment in 2 ways. Number one, we use we use sizers to put into the pocket, and so that's how I decide which is the best implant to use. So we'll talk about this particular woman wanted 350 cc implants. I put in a 355 cc implant and it was too wide, so instead I got a moderate plus, which is a little narrower and a little more projection, and has a little more projection, and I used a 350 moderate plus, and that looked a world better, and it didn't ripple. And so there again, experienced surgeons are going to use judgment there. Number two is that I was able to do a bunch of release of the lower pole. And so when I released the lower pole, the nipple rotated up while it was allowed to kind of settle in the pocket. And as it turns out, I don't think we needed a lift. So we didn't do a lift. And as a result, I think she's going to be super happy because she gets money back from her surgery because she paid for something that we didn't do, and we always immediately refund money when necessary. And number two, she doesn't have the incisions associated with a lift, and she was a little worried about that. So I think she's going to be really, really happy. But again, the difference in a lot of outcomes is the ability for the surgeon to kind of make some decisions during the operation, as we call game time decisions, and use intraoperative judgment, which is really, really important. So anyway, that's my 2 cents for the day, and hope you enjoyed it. And again, I'm not sure if I'm doing this well, so feel free to give me some feedback. That'd be helpful. All right, and I gotta find the off button.